Hi everyone, Elliot here again. Thank you all for sending me your emails and questions, and apologies I've been busy, but I have been meaning to do this video for some time now, so let's jump straight into it. Today we're going to be looking at some of the questions that people have submitted to us in the past. And first up we have Thomas, a runner from Singapore. Avid runner here. I do half marathons, full marathons, but mostly 10k runs. I'm very selective about the running shoes I buy, but I can't seem to shake off the heel pain at about 15k into the run, regardless of the shoes I wear. I've tried stretching, rice and various massages. Can you please advise? Thanks. It's most probably going to be the plantar fascia or the Achilles, especially with runners, that's probably injured. It's actually ill-advised to be running on this injury. And when it comes to footwear, yes, there are footwear that are very, very good at preventing and obviously improving the efficiency of the runner. But as I say to all my patients, what you need to do is make yourself a blank canvas first. And what that means is we try and get rid of the pain for you and improve the integrity and heal the tissue that's been injured, so that when you wear these shoes, your injury won't come back. I've had patients who have had this for years, not wanted to do any treatment, come back to me after leaving it for so long, and it's just been very, very difficult to try and heal. With other patients, they've had it for 2 years, and there's this one guy, he came and saw me, we underwent, an 8-week course of treatment, and we managed to get him back to running. He was very happy, and it's those sort of stories that, make me feel really good about what I do, and knowing that there are things out there to try and help you and get you back to running, because ultimately the goal is to get you guys back on your feet and doing the activities that you love. Okay, so we've got Patrick from Passaris. Hello, just want some advice, as recently I noticed an increase in pain in my knee when I walk down the stairs. Should I just get used to it, as it's due to aging, as my doctor said? Okay, so firstly, you can age comfortably or you can age with pain. And if you're picking up these symptoms at a very young age, you've actually got a vast treatment options available. If you leave it, and as you get older, those treatment options just become very narrow and there's not so much options available. As you get older and you've got these injuries, they just become a little bit more difficult to treat. Obviously, if you start early, the options available just make it a little bit easier for both patient and practitioner. So if you are experiencing this pain, please go and see a low limb specialist. This is where a podiatrist can help, and just get a diagnosis and find out what options there are for you going forward. Okay, so our next question is from Joseph from the UK, who has a question about his Achilles tendon. Wow, so I've got a UK fan base now. This is brilliant. So he's asking, I've seen multiple doctors and recently had an MRI showing my Achilles is ruined. Is surgery my only option for Achilles tendinosis as per the MRI report? Do you have any other solutions? Okay, so I don't really know what you mean by ruined, but let's assume that it is ruptured, then surgery is your only option. But if it's not, then this is where you might be able to seek conservative treatment. And this actually reminds me of one of my patients who found me through one of my videos, who lives in Korea, and that is right, I've got a Korean fan base as well. I'm getting international. He had a very similar issue. His Achilles was very painful. There was calcification inside the tendon as well, and he was being told surgery was the only option. And to be honest, this isn't always the case. Take that MRI report, go see a lower limb specialist and have it checked by them. Because if they deem that this can be treated with conservative treatments, it'll be far better for you. And the reason being is there's no downtime and there's no side effects from the treatment as well. Okay, so we got Cynthia here, a volleyball player from Tapio, and she asks, hi Elliot, I play volleyball and dance a lot, and my toenails keep bruising and falling off. Must I wait till it falls off, or can I just pull it off? No, don't pull it off. Please do not pull them off. If your nails keep doing this, there's obviously an underlying condition that needs to be addressed. Now, this could either be the activities that you're doing, it could be the shoes that you're wearing, or it could literally be a biomechanical issue. And if it's any one of those three, they can easily be addressed. There's a story of when I was working back in the UK, I had a semi-professional footballer come in, and he basically said to me he was so fed up of his nails constantly falling off, he asked me to remove them and do a very special technique that stops the nails from growing back. So we removed all the toenails and we did the special technique. But yes, I repeat, do not rip your toenails off. Okay, so next up we have Jonathan, an Army regular. See, I like these cases. Hi Elliot, I've got very sharp heel pain, especially when I just wake up. It's so bad that sometimes I have to hobble to the bathroom in the morning. The pain only goes away after some time. Is it because my legs need to warm up first? This pain has been for a few years already. Will it recover or do I need to go for surgery? Okay, so the symptoms that you're presenting with, the sharp pain in the morning, disappearing as the day progresses, sounds like it's very much like your plantar fascia, and if you Google that, it will come to plantar fasciitis. Now this tissue is a banded tissue at the bottom of the foot from the heel to the big toe. It's very important in absorbing a lot of shock, and it's also very important in storing up energy to propel you forward. So keeping this tissue healthy is fundamental. Will it go away on its own? No, it won't. Obviously, you army guys, you have to undergo the IPPT and SOC, these very two important tests, and I believe there's like a 6-month window. It reminds me of a story of a patient who had very similar symptoms to yourself. Heel pain, pain in the morning, disappearing as the day goes on. His concern was, if he went for surgery, would he recover in time to undergo these tests and get cleared? So what we did is we spent 2 months together and we did the conservative treatment, and I'm happy to say he's actually far better now. He's right as rain. And he went and did his tests and he cleared them. So Jonathan, my advice to you is go and see a podiatrist, see what conservative treatments that they've got, and get yourself fixed so that when you do these tests, you can clear yourself and you can enjoy a fruitful career in the Army. Okay, take care, buddy. Okay, so our next question is Gerald from Raffles Place, and he's got a question about limb length differences. I go to a clinic regularly for my hip imbalance as one of my legs is shorter than the other. I have to go almost weekly for adjustments. Is there a permanent solution with podiatry? I cannot keep going back to clinic every week looking for a long-term solution. Thanks. Okay, fantastic question. I get asked this a lot. Limb length, there's 2 different kinds. You've got muscle imbalance, which is tightness of the muscle causing one leg to be longer than the other, or you've got true limb length. Now let's talk about the true limb length, because this is what it sounds like you've got, where one leg is longer than the other. This can range from 5 millimeters all the way to 3 centimeters. If you leave it, it will most likely cause you hip, back and knee pain. Now, can podiatry help? Yes, it can. We're low limb specialists. We deal with this all the time. What we always say is everybody does have a mild difference in their limb length. It's how does it affect you with your everyday life? So what we normally do is we bring the patient in and we have to determine which one is it. Is it true limb length or is it muscle imbalance? We do a full assessment to determine how much of a difference it is. And with that, we then put things in place to adjust the height. So for you, Gerald, if you have got this limb length, stop pulling your leg because it's not going to get any longer. Seek a podiatrist and see what we can offer for you so that you don't have to come back and see us every week. Okay guys, if you found this video helpful, please like the video and share it with your friends. And if you have any questions, please leave a comment below and I will address it in my next video. Okay guys, take care.
Thank you for watching. If you find our podiatry videos informative, please like and share them with someone who might find them useful. If you need to contact us or find one of our clinics, go ahead and take a screenshot now. To subscribe, you can click this button over here. See you in the next video.